So with this, I want to hand it over to Laura and Amber, who are going to talk a little bit more. You've heard us reference Made for VA multiple times and have now seen some of the ways that it's starting to come to life. They're going to put some meat on those bones to introduce potentially some opportunities for you guys to join as well.
Thank you, Ann. That was quite the lead-in. So just really quickly, my name is Amber Brown, 2 colors. I always tell people that. You won't forget me now. I'm licensed clinical social worker and also a new addition to the Strat Lab. And Laura, will you quickly share a little bit more about yourself?
So I'm Laura Kusamoto. I am a consultant. I have a lot of technology background, having worked for Meta and Disney and Kaiser Permanente and other places. So I'm bringing that to the VA and very, very happy to be working on Made for VA.
Thank you. So, Dr. Kirsch, great lead-in. I hope you guys are excited to hear more about Made for VA. So first, I get the lovely opportunity to introduce our program management team. You just heard from Dr. Kirsch. We've heard a lot from Dr. Bailey. We also have Dr. Zhang, and then Angela Gant-Curtis. But I would be remiss if I didn't mention Caitlin Rollins is also part of our program management team, as well as Laura and I.
All right, so maybe we've seen this movie before, thinking about interoperability. The vision that Dr. Kirsch was laying out requires that all of these systems can talk to each other. When a doctor orders a VR treatment, that the system knows what that is and it can provision the headset and collect the data. All of that requires integration, and it also requires interoperability so that we can have multiple applications on a headset, for example. But we've seen this movie before, right? In the early days, the electronic health records were not particularly interoperable. They built their own sort of walled gardens, and therefore that industry has been forever stifled in its ability to have systems communicate with each other, even today. How many of you have sent a fax order recently? Right? People are still doing that. So anyway, it's not all their fault, but we all know that interoperability would help a lot. In the little cartoon here, they're trying to send an email. The HR company is sending an email to folks, but they can't read it because it's not compatible with their browser. We're talking about compatibility. Let's move to the next slide. So on March 1st, Dr. Kirsch made an announcement at the IVRHA conference. She said that the VA is going to create this Made for VA guidance and requirements that will help the industry to build products that can be accepted into the VA practice. And we're talking about healthcare practice, although training also will come along as well. There are 4 pillars of this. We started with 3. One is applications. Those are the applications running on the headsets or the hardware or even the software. There are the devices and platforms. Those are the SDKs, the APIs, the headsets, and so on. And then there's the enterprise level. That's what's required to run on VA systems. There's a huge enterprise infrastructure that has to be integrated with. And we added 1 layer since then, which is business. And Dr. Kirsch referred to that as the contracting. It's really important to be able to have a contract with VA and have that go smoothly as well. And so we want industry to understand what those requirements are. Let's go to the next, please. So also at the same conference, Bob Fine and I coordinated a special session gathering together 20 people who have a lot of experience implementing lots of headsets, hundreds of headsets, thousands, even 10,000. The person from Accenture was there. And we wanted to ask them, what's working for you? What's working for you in scaling up a headset implementation? And what's not working for you? So in 2.5 hours, we did all the IDEO-style ideation, had our little voting dots and everything. The major issue that everyone cited was lack of interoperability. It's stopping scaling for everyone across the industry. So that also validates that this is a very important issue that the VA is taking on. We do have this paper, by the way. We published a white paper and it's available. Folks have it if you'd like to take a copy on your way out. Okay, next slide. And back to Amber.
So I get to talk about my favorite thing. So where are we at with all of this? As Laura so kindly mentioned, the IVRA meeting happened, it was announced, we had a brainstorming session, and then we developed our project charter, which is going to help us identify What do we need? Where do we want to go? And how are we going to get there? Just high-level expectations. Currently, we've developed a draft of our guidelines, which is quite a large undertaking. And in the fall, many of you in this room are going to be hearing from us because we're going to ask for your feedback. I heard someone say yesterday, nothing about me without me. We need to hear from you. We want to include the frontline staff so that we can do what Dr. Kirsch said. How do we integrate this into the current workflow to make this work for you all? So that's what we're working to do, with the lofty goal of by October announcing this publicly at IEX.
Indeed. So why are we doing this? We've already talked, and I think that Dr. Kirsch set forth the vision that we want to realize. And I think this whole summit is really about what are the benefits of using immersive. Everyone's been talking about that. But what's the benefit of scaling immersive? That means that more people have access. That means when a veteran goes to the doctor and they ask for it, it's there for them, right? We go from thousands of people to hundreds of thousands to millions of people using it. That's where the VA is setting their target. So that's the real benefit, the ultimate benefit of what we're doing, although there is a lot of work to do. So let's go to the next slide. So one of the things we've done in the past couple months is we've taken those 4 pillars and divided them into some subtopics underneath. We're starting to figure out what are we going to write requirements around. We're calling them guidelines, by the way, because we feel the industry is too immature to set down hard requirements at this time. But ultimately, these will mature into requirements and then perhaps even standards that will influence the industry. We are emphasizing not only what makes XR work at scale, but what makes immersive work in healthcare. So there are topics in here that you wouldn't see in another organization's chart. You know, for example, clinical data interfaces, privacy of health data going into the system and going through the system. So those kinds of things are covered in here. So this is partly what we will be sharing out. It's a very, very long, detailed spreadsheet right now, and asking for comment in the fall.
And my next favorite part, this is quite a big undertaking, and Laura and I did not do this alone, nor did we do it alone with our program management team, so I would like to take a moment. This is our first March in-person meeting, so that was part of our team, but we have a large part of our development team here in this room, and if you wouldn't mind, I would love for you to stand up, just so folks can recognize who you are. So if you're on the development team, you know who you are, just take a stand. Thank you so much. We appreciate you all. If you have questions, we're here. And just remember, all those folks who stood, this is a really large undertaking, and they are welcome or willing to take your questions, hear some feedback. Like we said, we're going to be reaching out to you in the fall, and we look forward to hearing from you guys. Thank you. Laura.
One second. Thank you so much, both of you, for that. I'm going to make you two of the initial guinea pigs of what we hope to be able to incorporate the rest of the day. But if there is, let's say, one thing that you would like this group of people to take from what you just shared, what would that one thing be?
For me, it would be the need to streamline and standardize.
I'm going to mention something I forgot to mention. So 10 years from now, the next wave of computing will be upon us. We'll most likely be wearing it. So your computer 10 years from now will be something you're wearing, probably, and it will be communicating with all the sensors around the world and nearby you. There will be what we call ubiquitous computing. Immersive technology is the first step of that. And where we are with immersive technology is kind of where we were with Blackberries, or maybe pre-BlackBerry. We're like implementing the first Blackberries into the VA system now. That's a heavy IT task, by the way. And so that brought mobile phones into the IT departments and the enterprises across the world. But then what happens when the iPhone comes along, right? It's an explosion of what those things can do. That's exactly what's going to happen with these devices. So it's not just facial computing, you guys. It's going to be all around us, and the VA is leading the way in establishing the foundation for using this in healthcare. So think about that.
Awesome. Thank you. Well done. Thank you guys so much. One more question. You're not free yet. One more. Wait. One more thing. And you guys come to consensus on this. What's one thing that this group of people, and I will say, one thing I would love to see, continue to see, because you're certainly here. Continue to be present, continue to be curious, continue to take risks with us. But what's one thing that you guys would like to ask of this audience?
Consensus on this. Do we get a second to talk about it?
Go for it. Just go.
We've talked about this.
Yeah, you can phone a friend.
I want. So.
Phone a friend.
Well, I think we'll do two. So my request is going to be, when you are asked for comments, please think about the details.
Yes.
It's easy to think at high level. It's easy to say we want these things to plug in, but the expertise that we need to really determine whether this is workable or not is out here.
Yes.
This is definitely a community effort. It's going to take compliance, it's going to take vendors, it's going to take software developers, hardware developers. We need everybody's input. So please don't just look at the top level, find some details and dig into them and give us some criticism. I think that's what we ask from you.
Find the gaps. Is that our two?
Oh, do you want one more? You want to add one?
Well, I will piggyback on that and say, in addition to that, part of the streamlining and standardizing, and I think Dr. Kirsch really summarized it well, having been someone who worked at the facility and knowing how hard it can be when we get changes that roll down, is that if it doesn't work within my workflow, am I going to use it? Probably not. So I think in addition to utilizing your knowledge base in this room and then even outside of this room, is finding those gaps so that we can make sure this works for the folks that we're asking to use it. That's really key. If we want them to adopt it, it's got to work for them, make life easier.
Great. Thank you. Thank you both so much. That's it. No more. You can.